Sure, I will do it.
Good. Dr. Huerso, you want to add anything, Wes?
No, quería resaltar esto que acaban de decir ambos, que es muy importante tener la experiencia propia para poder contarlo, transmitirlo, difundirlo, y además para comprender cuando otros están viviendo la experiencia propia de reacciones espontáneas, que es algo natural, que es parte del proceso y que sigue siendo aprendizaje.
Okay. So what Dr. Worsley is saying is she wants to highlight that everyone should have their own experience, and it's nice that when we have our own experience in this, we can share, and because when we have our experience, we can comprehend better, we can open our minds, we can share a message, we can spread our message with our own experience and with others' experiences, and you can comprehend what other is going through. And about the spontaneous reactions, that is a natural process, and so for people also not to be afraid of the strong reactions or the emotions that goes out, because it's natural.
That now is natural. Yes, very good.
So, Vladimir, can I ask you something? What would you tell a person that is going through a diagnosis of an illness like lymphoma or cancer? What would be your words for them?
Okay. Definitely, I had a very good friend. Unfortunately, he died, and he had friend who got cancer, and he asked me to call him over the phone, and of course I did, and I am ready to talk to any person who has this kind of problems, and I think that I can encourage such person and show him or her such example like myself, that if I could survive, anybody can survive, and person has to believe in power inside of his body and his mind, you know. So I think to believe in ourselves, it's very important. So I see it like that, and I am sure it's very good if somebody is talking to person who is afraid and doesn't know what is happening, what could happen and stuff, you know. So I will stress again, I'm ready to talk talk and to explain to anybody like what I think about how to deal, how to cope with such kind of disease.
Well, I must say that, did I say that you're a very powerful man, very strong mind man? So a lot of people will not share. And I'm very happy that you have such an open mind, Rado. You know, you share with your own experience to help other people. Because I did have, a lot of, I help a lot of people, as you know that, but a lot of them, they don't want to share. However, fair enough, is people's personal, feeling and privacy. But like I said, like a person has to be like yourself, very strong-willed, very kind person, will put down, this barrier, right? And then come out and share and help other people. And how the mind, because at the end of the day in English is mind and body, because this is the boss. So once you get the boss control, obviously, the body can be easily maintained. And that's why we put it in the words like, that's why I'm trying to, shall we say, 28 years of my clinical case study, how the mind actually can help the body, the psychological thing, the power of the psychological power can actually help the physiological power. Okay, and that in the ancient Chinese term is called internal Taoist medicine. But obviously the name has been other people using different languages. It doesn't matter. So that's why I'm very also happy to have, these two, brilliant doctors and share with us, because psychiatry is the mind, the study of the mind, right? Yeah, it's another order medicine. So we can all share together, and hopefully, if we can help one person and in the future, and we've done our job. Don't you agree, Dr. Willis?
Oh, yes, yes. Thank you, Professor. And thank you, Vlado. Vlado, your words are really wise. You're a very intelligent man. Yeah. And you, Professor, well, I haven't enough words for you. I admire you, you know that. But also, I learned a lot from you. And I said it before, I want to say it now. You honor your ancestors because of what you do. And we as a psychiatrist with Dr. Worcel, we studied, we've been together in university, and then we made psychiatry in different places. But I think we agree in something, that is that the mind is not separate from the body. And when we work with a person, we work with their stories, their lives, their emotions, their body, and their mind. So it's all together. And that is what we have in common ground with any kind of medicine. So we should find more ground in common and see that the body is one. So a lot of things are going on inside of us. And when we have determined emotions, there are also a lot of things that we don't see, as you say, Neidan, like the hormones, immune system, a lot of things going on that expresses with words or with language, body language, or with some kind of emotion, but inside is the same language for everybody.
Dr. Worcel, would you like to?
Bueno, ya han dicho todos, estoy totalmente de acuerdo con todo lo que hemos conversado aquí, y ojalá...
Todos es claro.
Todos es claro, Vladimir.
I told you, this guy speaks 6 languages, is it?
Yeah, he understands that.
That is true? You speak 6 languages?
Sometimes.
Wow! So nice. Oh, that is
mind,
not for everybody.
Mind. Yeah.
That is power mind.
Yes.
And, sorry,
no, yes. And ojalá esta conversación y este clima tan lindo que se ve aquí se pueda transmitir y pueda inspirar a otras personas a tener esta curiosidad por conocer más sobre la metodología.
Dr. Worsel says she agrees with what we are sharing, and she says that hopefully this environment we are feeling today, we are very happy to share between us, that the audience can feel it too, because and give them curiosity and motivates them to learn about this, because it's very helpful, and it's life-changing in the sense that it gives you quality of life, because you work on your life force, in your inner alchemy, and you are your owner. So what better than that? I don't know how to say it. Professor, maybe you can help me.
Well, I could only say that if we use the yin and yang principle to look at this problem, like now, if we can say all medicines are good, all medicines are good, doesn't matter, it is ancient medicine, Chinese medicine, or Western medicine, right? Or even African medicine, Indian medicine, they're all good because at the end of the day, they all just try to help people. True? Yeah, just help the patient. So that would be very good. So, but the yin and yang principle would say that everything is only 50-50. So every medicine would have the 50% of chances of successful cases and 50% chances of failure, right? No medicine is perfect. So that's why I put across that 8 research, when I established this 8 research team, is a teamwork. So I'm trying to put, right, all medicine on the table. That means, for example, when a patient comes, I will recommend that because, I would say if, especially terminal case, right, like cancer. All this chemotherapy, it does work because why? Because like a cell, the cell die, rotten inside, and that turned cancerous. True. And it's how happened all the time because we're made of what? I remember 7.3 trillion or something living cell. Of course, cell dies, cell grow. So we're just talking about cell die, but nobody seems to talking about cell growing. That's the thing. Okay, yeah. But every second cell die, cell grow. So the thing is, when the cell die for whatever illness is causing it, now the term become the term called cancer. But is a name, that's all. Okay, but the Chinese side, we don't even have that name called cancer. And we know for 5,000 years, we just said, okay, sick. So we say just call it sick illnesses. It would be better. But the problem is when I found that when people hear like Lado is very important now to helping people, because the minute now these days people hear the word cancer, they give up. Oh, I'm going to die now. And I found that when I have a lot of successful case in cancer as well, but, I've got a lot of narrative, people pointing finger and this and that. That's why I'm reluctant to really share it. Okay. I only treated, the patient. But what I found is the psychological effect on a patient is worse than the physiological effect of the cancer case himself, because everybody says, oh God, why me? And they go down the drain and they start fighting. And they gave up as if they was, there's no other chance now. I'm going to die. Right? So that's why what I found out is, okay, so from the Western medicine, they got its good point, because why? Because cells die and they become rotten and they're toxin, right? Because they're poison and they poison the blood. Okay, now, a good point about using toxin against toxin, even in the Taoist medicine, even Chinese herbalism, natural body medicine, okay? They also toxin, don't forget. But the toxicity is not as high as chemical. Okay, yeah, but we do need the toxicity to kill all these cancer cells. True. And even Chinese side on the herbalism, like a mushroom, you eat the wrong mushroom, you're dead. Okay, yeah. So, but the power of the mushroom on many herbs and things, right? Yeah, maybe not as powerful as the chemical side. So a lot of the Chinese, even working with a lot of Chinese doctors and in university, in Hong Kong and China, they all say that it takes longer time, right, to help cancer patients because they don't directly kill the cancer cell. They revitalize other cell to kill it, and that's take time. But the cancer cell is rotten so fast that they fail. And from us, from the internal side, now we need, we need you to train and learn all the experience. And even when we zapped you and people refuse that, and it's difficult to, to put people in the subconsciousness. So we have all this kind of 50% of difficulty. So I would recommend people, even now, even in Hong Kong, and I said, look, if you don't have time, go to seek, right, Western medicine first. By all means, go to use chemotherapy again, because you have 50% chances of failing. So we are trying to help the 50% of not helpful. Okay, don't forget. But the problem is the 50% of successful rate. You have to be careful, because from my 28 years of clinical case study, relapse. Because at the end of the day, so when I've been looking into this, is the toxicity of it. Okay, we need that. Just as I say, we need that because we kill to combat all the rotten cell, but because it's gone into the bloodstream. So they kill, yes, they kill. They've done a good job, very good job, very fast, very accurate, very powerful. But they kill also when the blood go to another organs. They kill the good organ cell as well. And that's why from my own 28 years, right, of medical case study and experiences, I found that mostly a lot of the time that the first case of cancer after the patients was helped or cured, okay, it relapsed, but not through the first case, it go to another organs. So the relapse case, I found it a lot of the time is another problem coming out, not the original cancer. And that's where I look into, how come they should relapse, right? Relapse in the first case of the cancer, but no, they go to another place. So I found out is the toxicity is still remain in the blood, and the blood goes to another when it goes a cycle going through all the things, and it kill other weak organs, and then gradually that organ start to relapse. So that is, to me, is the shall we say the 50%, right, of not so good side effect. So I recommend the patient use the Western the drug first, because they're powerful and we need that toxin. But after that, if we don't have time to train, right, and do the internal, even take more time, by all means, now if you recover, do by all means go to the Chinese herbalists, get some herbs, because they are natural and they'll revitalize, because the toxicity only kill, because they kill, right? They don't revitalize. They're not, you call it, what you call it, nourishment. They're not vitamins, because that's not the job. The chemical is to kill the cancer cell, which is very good, very accurate, very powerful. That's why, but they lack of that revitalization. So the Chinese herb, all the herbalists, because they're natural, they don't have that killing power, but because they are for natural process to revitalize the growth of the cell. And then later, by all means, after that, do use the Chinese herbalism, right, for body to cleanse. So when the cell regrow and the function of the organs getting better, right? For example, you pass through. In Hong Kong, what I found is a whole lot of Hong Kong have large intestine, bowel cancer and things, large intestine problem. And because a lot of the time that when the blood goes into this, the organ, they kill all the organ cell, and people cannot pass, right? And that means the cancer patient have the whole sack of poison blood inside the body, and they carry it through, carry that because they cannot pass, because they fail in the excretory system. So when I was advising a lot of people, a lot of patients in Hong Kong universities, different university, I would say to them, take the first, go to a Chinese herbalist, tell them what you want, because some Chinese herbalists, they don't diagnose it in that way. So I said, make sure that they give you enough herb, right, to make you go to the toilets, because poison's got to come out, either through down here or out here, or through the sweat. So these are the three-way internal Taoist medicine. We look at it. Rubbish got to come out. We call it detox, because you don't want rubbish inside. Yeah. So that's why, even if that after, we use Western medicine, very good, nice frontline soldiers, right? Yeah. And then we use, right, Chinese herbalism, external Taoist medicine, we call external Taoist medicine as, right, the backup, to revitalize the supply line. And then after that, we use the internal Taoist medicine, spontaneous, actually induced, because it takes time to learn to induce, right, the natural body medicine. So what is the best, right? Of course, is your own body, natural body medicine. So if we can put all the medicine together, and I think we can help a lot of people. And that's why I set up the 8 research and try to put all this down. And hopefully in the future, we can help more people. Don't you agree?
Of course. Totally agree. And I think it's, that is what I find so interesting, the Nei Dan Dao, because it's preventive, and all the things you said before, you can do it also with time. The cleansing and all that you do with herbs, you can also do it with your methodology. And we were talking before about lymphoma, and these exercises can help you to stimulate the bone marrow. So what else, more inside the body we couldn't go. So
I know, that's why the only thing to go in there is what we call the energy. And that's why the misinterpretation of the word energy. So that's why in my teaching, I said, shall we clarify, right? Or shall we identify what type of energy we're talking about first? Is it musculoskeletal energy? Is it biochemical energy? Or is it neurological energy? They're all energy. So is the bone marrow, right? Yeah, of course, it's biochemical energy, right? Because it's right inside something happening, but something has to deliver that messages into the bone. So the bone listened, because that is electrical, because that is the nerve endings and thing. And that is obviously the neurological energy. And then also because the bone is moving by the muscular skeletal energy. And that's why the methodology comes in. So the whole entire thing now, we can able to put our head together and formulate it into a more, shall we say, acceptable term of today's people understanding. Because if you just use the word energy, it becomes so mysterious and everybody push it into the spiritual side. But this is not. This is health, self-healing, your body help yourself. So you can't close your eyes and just, that's why I always said to people, you come to the wrong teacher. If you want to come to, relying on closing your eyes and cross your leg and have lotus stance and hold a finger, you don't even know, is he holding this finger or holding that finger or holding this finger? What's the point of doing it? So it is a human science.